Genetics has come a long way, and joining us to talk about that now with older children is Dr. Antonie Kline, who is the Director of Pediatric Genetics at the Harvey Institute of Human Genetics, board certified in pediatrics, clinical genetics, molecular genetics, and cytogenetics. Is that correct? And Marcia, right, Ferguson, who is also a genetic counselor. We have the genetic counselors here too because you're often the ones who work, you do the research, give the diagnosis, do the testing, and you're often then kind of working with the families or the individual too at the same time. So it's a really nice partnership for the people who are with you, for your clients or your patients. So thanks for being with us.
Thanks for having us. Thank you.
And how recent is this type of genetic testing, postnatal, as we called it before? Because it surprised both of us, and it must be surprising to others.
So genetics has been around at least since the early 1900s, and pediatric genetics evolved because many conditions were present in children. So it's actually a well-established field. Interestingly, not just pediatric geneticists, but there's also internal medicine geneticists for when people are adults.
So let's just talk about the reasons that someone would be tested, or parents may make the decision to have their children tested, or they may get tested themselves. What are some of the reasons for doing that?
So actually, most of the referrals are for complete evaluations, and there's not always testing that we offer, but what happens is a baby is referred possibly for a birth defect or something unusual about how the behavior of the baby, how the behavior is. And then older children can be referred for the same thing, a minor finding on exam, or developmental delay, or behavioral issues such as autism. And the pediatrician wants to find out, can we provide information to help with the recommendations and the care for the child, and possibly testing that could pinpoint the cause.
Okay, you mentioned autism. What are the other things that pop up that would get postnatal?
So specifically for behavior?
I guess. I mean, just what are they? There's autism and...
So there's...
Sometimes you don't know.
There's self-injury. Some patients injure themselves. There can be depression or anxiety accompanying, say, developmental delay, and that could even indicate an underlying syndrome. Development is huge. People have...
So I have lots of questions about that, because I didn't realize that for developmental delay that there is testing available that would give you valuable information. And how does that testing, does that include a blood test, an MRI? How do you go in and, if I brought a child in who has a speech delay, let's say they haven't said a word and they're 4 years old, and you're trying to figure out what's going on, how would you evaluate that child from your expertise?
So typically, we will be referred a patient if there's maybe more than one thing going on, and the pediatrician might want our input. So maybe just speech delay by itself, we might not see those patients. But if the pediatrician notices that the child's hair hasn't grown, or there's a birthmark, or the child's known to have a heart defect, then they would ask us, how can you tie these things together? Is there an underlying condition, and could you offer testing for something? So it's always a stepwise, slightly lengthy process.
The first symptoms you mentioned to me all sounded like psychologically based, but then you mentioned
neurologically too.
Okay.
Yeah.
To me, that might be one and the same thing, but there are other physical things that bring you in.
Yes, definitely.
I could say a little bit. So when we're talking about young children, I think oftentimes they may get referred, as Dr. Kline said, because there could be an unusual feature, an unusual finding, something physical, like their facial features don't match the family's that well. Maybe their chin, the child's chin is very small, or their ears might be a little bit different, small, or something like that. Sometimes growth could be affected. They may be larger than you'd expect for their age group, or they may be smaller, as well as developmental issues.
And what could that signify, those traits you just mentioned?
So there could be an underlying syndrome. So the child could have a genetic or a chromosomal syndrome going on, something that would tie the different things together. And so we, would evaluate them and then would consider whether testing might help us to identify their potential condition. And you would, mention the testing. And so if we were going to go down the road of genetic testing, we would often start with this test called a microarray. And it's a way to really assess the chromosomes to see if there are differences in the amount of chromosomal material, sort of on a finer scale.
So that's a blood test?
It's blood, but it also can be done through saliva,
Okay.
through a cheek swab, something like that, which is nice for young children to not have to put them through the blood draw. So that's sort of a starting level of testing to sort of screen for changes in the chromosomes. And in other cases, we may suspect a specific condition, and then we may just target that particular gene and test one gene.
Would you do DNA testing at this point? Because, okay.
Yeah.
It's so interesting because prenatal is so before, and you're almost like solving a mystery. So you have a child or you have a teenager that's presenting a certain way, and everyone's trying to figure out the piece of the puzzles that can form with what is happening, which would help with treatment and so forth. Is this what you're doing? I would imagine this is growing by leaps and bounds, this type of area of expertise.
So there are over 10,000 syndromes and probably more identified regularly. So in a sense, it's growing with new discoveries. Also, newer genes are being identified, and we have more in our armamentarium. But I think that physicians are fairly comfortable now referring to genetics to be the mystery solvers, as you say.
But new genes are being discovered?
So we know that there's about 20,000 genes, and they were identified when the human genome was finished. But the thing is that it wasn't quite finished, and areas that they thought maybe were 3 genes that they hadn't identified have ended up maybe being one large gene, or vice versa. And so there's an even newer test than the microarray that's helping to pinpoint newer genes.
How often do you have a parent who will come in with a child based on maybe a recommendation by their pediatrician, and they're trying to find something, and you run the testings and you just can't find anything? Like it just was inconclusive, or how often does that happen?
So I would say that happens probably at least 25% of the time. There's probably, even if we do specific DNA testing for conditions and they are negative, there's probably hidden changes not in the genes, which are only 1% of the whole genome, but in the other 99% that we're just only now starting to be able to investigate.
The other thing that...
At least you've ruled out something, though.
Right.
Right.
I think the other thing that happens is that we may see a child over time, and we may not determine what their diagnosis is in the first, several visits, but then as they mature and grow, we begin to get other clues and other pieces of information, and testing improves, and so then we may arrive at a diagnosis, several years into seeing them.
Do you also delve into family history on the parents' part?
We do, and that's one of the important roles of the genetic counselor, is to take a 3-generation pedigree. So drawing out a family tree, and we're looking for clues, either other family members who have any of these symptoms or features, and also just looking for other genetic conditions in the family that we can give the family information about.
And 3 generations, are we back to grandparents or great-grandparents?
Grandparents.
Okay.
We have a question from the audience?
Yes, we do. The question is, the example of birthmark and speech delay was brought up. What is this association? Is there a syndrome?
So there's many types of birthmarks. There are probably, I can think of 10 or 15 conditions that might have a slightly dark form of a flat birthmark. There's probably 5 conditions that can have a pale form of a birthmark, and birthmarks together with speech delay or other developmental delay probably very, very common. So again, getting the family history, getting the medical history from the child, doing a careful physical exam. Every involvement with us includes a very detailed physical exam where we make measurements of the whole body and compare them to charts, and then trying to figure out, is there a specific condition or conditions that
So
could fit?
you're referring to birthmarks, surface birthmarks.
Right.
Pardon my lack of knowledge, but it's just a birthmark, right?
Sure. I mean, most people in the world have a single birthmark. It's more, are they significant when paired with some other finding?
Huh.
How about for the parent of a child or a teenager who already has been diagnosed with a condition, already has something that they've been working on, but then wants to delve into, was it genetic? Does that make sense? So let's say they have autism, and they've already been diagnosed with autism, but now they wonder, the parents wonder, am I carrying something? Is there something abnormal about our genetics? Should I have another child? That kind of thing. Are people coming at it from that perspective as well?
Sure. Often one of the questions is, could this happen again with my future children? So we often see families where that's the situation. And then even though autism itself has been diagnosed, that's a broad term.
Yes.
And then we might recommend specific testing, like Amy said, Fragile X testing, or Marcia said microarray, etc.
Do you also tell, let's say, a teenager that they have something that they may have gotten from their grandparents, so their having children in the future could also be affected?
Sure, we do. If we do make a diagnosis in a teenager or an older child, we do sort of casually mention, when you're thinking of having children, you could pass this on. And depending on the age of the child, we don't
that's
go
a heavy,
into it anymore.
Yeah.
It's pretty heavy.
And some counseling goes with that, I hope. But
Sure.
I mean, you must counsel them before they get genetically tested, I would imagine, in many cases, to really determine if this is some information they want at this point.
Yes, definitely. Some families, I think, are hesitant to have a genetic diagnosis, for all of these reasons. But I do think for many families who have been dealing with their child having delays or issues for many years, they often want a diagnosis because they want to know, is there a chance, for more children? Is there a chance for other people in their family? What does this mean for their child? Can we help manage their child better if we have more information? So,
do families sort of push you for a diagnosis when you're not really certain? They want to have a label.
Yes, I do think that it can be very disappointing for families when there isn't a diagnosis, when they suspect there is something going on and it just isn't clear what it is. It can be a frustrating experience.
We also always tell families that all of us in genetics are constantly going to meetings to hear about the new developments, and we have contacts in the field. So we urge them to keep in touch with us and have follow-up annually or every other year, because new things are written about, and then it might apply to one of our patients.
I just remember in the past where hypertension was first talked about, then it was ADHD, and then there were other things tossed onto it. And a lot of those children go on to be diagnosed with other things, including autism. And I don't know where I was going with that. It was just a comment.
One thing, I used to work with the Huntington's Disease Society, and one of the earliest, I think, tests that were available was for Huntington's, which is a very devastating, completely genetic disease, right? And I think I talked with a lot of people who struggled because I think the carrier has a 50-50 chance of passing it on. So the children never, they had to decide, do I want to know, do I not want to know? I know what my fate is because I saw one of my parents go through it. So you must run into, maybe not that extreme, but that's a pretty big thing. That's a pivotal moment to do the testing. It's a pivotal moment to read the results.
Right, absolutely. And actually, specifically for Huntington, it's so significant in every way that we always refer to a Huntington clinic, such as at Hopkins or Maryland, because they have they have psychology, they have social work, they have everything built in for that. But for our patients, if there's a pre-symptomatic condition that one of the parents carries, for example, generally we don't recommend testing people under 18 because we want them to make that decision. And sometimes we will get families who push and want a diagnosis even when it's not relevant for the child until they're an adult.
Or sometimes the general practitioner, the pediatrician, or the internal medicine doctor will run those genetic tests, which, we think it's just so important for the patients to have the proper counseling and make an informed choice. And sometimes we get those phone calls, would you see this patient? We just did a test on them and they have something.
So they need to go further. They want
Yeah.
you to kind of, because that's where you shine. I mean,
Right.
are there certain conditions that you're just waiting to get a genetic test for? I mean, you're just hoping that will come through. I mean, certain things are we on the brink of learning more about that come to your mind?
So probably autism is one of those, because we do have a sort of standard group of recommended tests that we'll go through, and if certain ones are negative, we'll go to the next step. But there's a high percentage where families don't find out about that, and because it's so common, it would be really amazing to know. When I was in training, there wasn't much known about hearing loss, for example, and now there's a big panel, and we can often identify the cause and help families with that. So that's another pretty common thing that has come a long way.
I don't know how long ago you were in training, but autism,
A long time.
autism seems to be booming.
Everywhere. It is.
And everybody's thinking it's just the fact that we now can diagnose it. Is that your feeling?
Yes, I think the diagnosis is very clear with the criteria, and there is, I think, a higher incidence than quite a bit.
It can't be just diagnosis.
Yeah.
There's too many.
But there's multiple causes, and certainly the thing with immunizations was put to rest, although not everyone still
Believes it, yes.
But isn't that part of the problem? And I hate to just focus on autism, but because it's such a wide, broad spectrum, that there'll be no one test for autism, right?
Sure.
There may be multiple, and still may not be. I mean, it's so Fragile X really is the only part of that spectrum that you can definitively test for, right?
Well, but we do recommend the microarray. There can be a tiny deletion on one of the chromosomes or a duplication that is known to be associated with autism.
So are you surprised that more people don't come for testing? Because I happen to be in this autism world, that's why, and there are very few people I know who have done it.
So again, most pediatricians and other specialists will tend to refer to us if there's more than one thing going on. Although I think autism, there is a pretty standard set of recommendations. So I think we tend to see the ones that have a birth defect or something else.
At this point, is there any condition that you can identify through genetic testing and turn around or end?
So more and more there are conditions that have treatment. When we go to meetings, there's always a new couple of conditions that actually have treatment, and all the researchers who are working on each one of those conditions are looking for treatments in the animal models, and if those are successful, then it can move into human trials, and there actually are treatments now.
Do you find that there's a sense of relief when somebody finally figures out through genetic testing, if they figure out what is going on with them or their child?
Yes, we certainly have seen families who have had a long voyage with their child with multiple issues, and time again testing has been negative, and finally they get a diagnosis, and you know that it's not, the parent knows it's not their fault, and also we can help predict what is going to be needed as they move forward. As Marcia said earlier, I think there can be a huge relief.
I'm trying to refer to my emails, but I'll just ask you the question. It seems like a couple days ago we got an email from you, and you wanted to talk about a specific, is it research that you're doing now, or something that you've seen with increasing frequency?
So I've worked since my training with a condition called Cornelia de Lange syndrome. Which
I'm glad you said it.
Yes. Say it again.
Cornelia de Lange syndrome. It was named after a Dutch pediatrician who published it in 1933. And it's a very rare condition, but I've worked on it my whole career. And we have clinics at GBMC twice a year, and we get referred patients with it, and I love
From
working
around the
with
world,
it.
I would
From
imagine.
around, well, certainly around the United States, but I've traveled worldwide to see patients with this.
And what is it?
So it's a rare condition. It's generally of small stature, so they're proportionately smaller than average, often with intellectual disability or learning disabilities, often with behavioral problems, and then various abnormalities physically, such as missing forearms, missing digits, heart defects, cleft palate. There's a whole range of how people can present.
You say stunted growth. Are we talking dwarfism or
So dwarfism tends to be disproportionate, where maybe the arms and legs are shorter and the body and head are normal, and vice versa. Proportionate small stature is just tiny people that with the right proportions.
And how was it discovered, the syndrome?
So-
Obviously, the person's name.
Yeah, so she wrote about, she was the first person to put two unrelated patients together in an article, and then over the years more case reports were written, and people just came to appreciate it.
We have a question from the audience.
All right.
Just flipping the script a little bit, are tendencies towards social diseases like alcoholism and drug addiction indicated in any DNA
Great
tests
question.
or testing? Sorry.
Not that I'm aware of, or certainly not that we use in a clinical setting.
They do say it runs in families, though.
Yeah, I guess we would say we can see those things in families even several generations back, and there's a few conditions that can present that include alcoholism, but it's what we would call more of a multifactorial condition where genetics plays a role and probably environment plays a role, and similarly with other conditions like that.
What would those few conditions be that you mentioned?
In addition to...
Well, you said it shows up in a few conditions besides alcoholism.
Oh, so Tourette Syndrome is a condition that most people have heard of, where there can be verbal or motor tics, so people can say things spontaneously and not intend to, or they have movements of their body or blinking and other things. And in those families, we see a higher incidence, for example, of alcoholism and also obsessive compulsive disorder. So that's the one I was thinking
Okay.
of.
Are genetics fixed? In other words, once you test for something, your genes don't change. You can't do anything to change the course of whatever's set in your map or whatever.
Right, that's an interesting question. So yes, your genetics are set at conception, and the genes don't change or mutate once you're conceived. But between parent and child, there's many mutations that can be acquired on the way or through things that occur right at conception. Would you agree?
Yeah, I would agree. I mean, there can be post-conception changes, but they tend to affect just a subset of the cells of the body. So a person could be mosaic and be mixed for having a change in some cells, but not all cells.
What affects us more, genetics or the environment?
Genetics.
Yeah.
Good, that takes a load off my parenting.
Is there anything you've been
It's not my
dying
fault.
to bring up that we haven't elicited from you at this point? The one question you've been dying for us to say.
Well, I just thought this was something we want to share. So we have followed a patient that we finally figured out what this patient had through whole exome testing. And it was a gene that hadn't really been known before, what the function of the gene was. And through whole exome testing and then this sort of almost worldwide sharing of data where different physicians can look and find other physicians who found a patient with a change in the same gene, and we discovered the diagnosis for this patient, and the condition is named after Dr. Kline.
Well, very good.
That's really cool. I mean, I hate
That's amazing. Is what it
And more
is.
and more patients are being discovered all the time.
What's the name of the condition?
Kline Syndrome.
How does that feel?
So it was pretty exciting. I never thought I'd have a condition named after me. And actually, I got an email this morning of another patient in Europe who they suspect, and the testing has shown it.
Again, the syndrome is?
So it's AU-Kline, Kline, and it was really because we wrote the first article with our colleagues from Canada and myself, and Dr. O was the first author and I was the last author.
That's very
In
exciting.
the catalog.
The symptoms are?
So there's
You don't have it.
You never know.
So growth tends not to be affected. Intellectual disability is on the more severe side, and there can be specific facial features. There can be problems with the kidney and the renal system, and scoliosis, and some possibly there's some sort of a long list of conditions, but it's
So the fact that there's more genetic testing is telling us more than just for that one person. It allows you to compare other people and bring it all together. Is that correct?
yes, in a sense.
So it's a good thing that
And so
more
for-
people are getting genetic testing.
Right. So, for example, from this family, the mother has been able to connect with the Canadian family and other families that are now trickling in, and they formed a little group, and we're going to have a meeting of all the families in the coming summer at GBMC.
Very good.
That's really cool. I'm surprised you're not traveling all over talking about it, but I'm glad you're here. I think we have another question, right? I want to make sure we get to that.
Sure. Earlier in your discussion, birthmarks came up. So the question from the audience member is, would a pediatrician likely know to point out an unusual birthmark that could be linked to a genetic condition? Or is this something that parents typically identify themselves?
So I would say most parents notice if their children have birthmarks or a single birthmark. We would expect the pediatrician, if there were a number of birthmarks, we would expect the pediatrician to think that it could be possibly due to an underlying condition and bring it up to the family. And many people have 2 or 3 birthmarks. Often we'll find a parent and a child have a birthmark in the same spot on their body, which is interesting. But I think if they're concerned about an underlying condition, the pediatrician would.
And it wouldn't be just the
Bring that up.
birthmark. There'd have to be other things going on. It's not like you have a kid with a
And
birthmark.
It's usually not a single birthmark. It's usually a constellation of them.
Okay, a lot of birthmarks.
Up until today, I thought birthmarks were just,
Can I get to this one question? I feel bad if we don't, in case Ruth is watching.
Okay.
So Ruth wrote this question, and she mentioned something that I'm not going to know how to pronounce it, so you can correct me. Would you please advise me of any new breakthroughs, such as medications or procedures for relief of gynecomastia
So
in young boys?
So gynecomastia is enlargement of the breast, especially in males because they don't typically have breasts. And it's fairly common in the general population. One or both breasts of males can be larger in some people. There is a specific genetic condition, Klinefelter syndrome, which is an extra X chromosome. So there's 3 sex chromosomes instead of 2. And Klinefelter syndrome can have gynecomastia with it. In terms of management for it, I'm not aware of specific medication, but sometimes surgery can be done to reduce it.
Yeah, and she goes on to ask, and I'm not sure this would be your area, but does the consumption of soy milk have any bearing on its development, and or other foods contributors? So this would be, you would need an expert on that particular condition.
Well, estrogen can increase breast development
Right.
in males. For example, if they take estrogen for prostate cancer, I think that's a possible side effect.
But is this a condition, or would this be a symptom that you might have genetic testing for?
If we suspected Klinefelter syndrome, we would do genetic
Okay.
testing. I think soy has some natural estrogens in it,
does.
so that's probably why she was
Yeah.
asked.
and this
Yeah.
would just be a cosmetic problem
Yes,
anyway.
absolutely.
It's nothing you have to fix.
Right.
Another audience question.
Hi, my name is Laura. I have a question going back to the birthmarks. I'm very curious about this.
Okay.
My daughter has 2 strawberry hemangiomas. Is that also considered a birthmark, or do we know anything about hemangiomas or relating to any sort of illnesses?
So hemangiomas are a collection of blood vessels under the skin, and they tend to be raised. Many people, again, have 1 or sometimes 2, and there are genetic conditions that can go along with an increase in hemangiomas. But again, I would expect there to be other findings in the child, possibly development issues or more neurologic issues to indicate an underlying syndrome.
Interesting. Very interesting.
Yeah, thank you, and thank you for all your questions. A lot of interest in the birthmarks
Yeah.
today.
Well, again, like me, I think.
Because I think that affects everyone, right? Pretty much. So people are,
and
thinking,
everybody just assumed it was
right.
marked
And do you
on
know
your
how
skin.
many people have, like, maybe a child with some sort of issue, and they're like, well, they have a birthmark, and that's going to be the thing that's going to get them to call you. But
Yeah, you're gonna get
you
lots
can
of
walk them
telephone
through
calls.
all of that. Well, I think that's all the time we have, and thank you so much. It's really been so interesting talking about genetics.
And I should preview that next month, January, is Cervical Cancer Month, and we will be doing a program on it. It will actually start with 2 Year Health at 12:30 on Facebook Live, and then what we call ourselves,
Greater Living.
Greater Living.
Because we are living a greater life just
I
by
like to
being
call it
here.
the Guide to Greater Living, but I'm not sure we're guiding. But anyway, that will be January 10th again, 12:30, and then we're on at 1, and we hope to see you then.
All right. Dr. Tony Kline of Kline Syndrome, right? And Marcia Ferguson, thank you so much.
Thank you for
Thank you. Woo.